Good morning, everyone. It's Facial Plastics Friday. Dr. Brace here, and today I wanted to go over aging face and neck and sort of what we have available. We posted yesterday on our account about Profound. You can see my pictures after Profound. What is that? I've done a post on this in the past, but very quickly, Profound is radio frequency microneedling. And what that means is there are microneedles that are passed into the skin, and then radio frequency energy is passed between the pins or the needles to create very precise areas or zones of injury, which then your body heals and creates new collagen, new elastin, and hyaluronic acid. Now, how does this differ from something like Morpheus 8? Morpheus 8 is not paired needles with energy passed directly between the needle pairs. It's a little bit different. So in general, you need more treatments with less downtime than with Profound, where you need one treatment and you'll have downtime, guaranteed downtime. You swell up, you look like you gained a whole bunch of weight, you'll have a jiggly third chin. But that goes away in about 5 days. And then it takes about 3 to 6 months to see the results of your skin tightening. What's it doing? It's creating collagen. Collagen will help thicken your skin. It's creating elastin. Elastin will help tighten your skin. And hyaluronic acid, which is the same material or substance that's in filler, and that binds water 1,000 times its weight in water and hydrates your skin. So what does Profound do? It tightens, thickens, and hydrates your skin. And that's it. It's a skin treatment. So we love Profound for people that aren't interested in surgery, or for facelift patients, necklift patients that want to prime their skin and make their skin look as healthy as possible before surgery, or after a face and neck lift. The quality of the skin won't change from surgery. We're just repositioning and trimming excess, repositioning the SMAS, repositioning muscles, contouring things, but surgery can't make your skin healthier. And so as an after treatment, after a face and neck lift, you can use Profound to do that, to make your skin look as healthy as possible. So that's what non-surgical radio frequency microneedling does and how we use it in our practice. Now this week we've had a number of people inquire about aging face surgery, and specifically these are usually women that are in their 60s or 70s that will contact the office and say they want a lower facelift only or a neck lift only. They're not bothered by their face. And while I can understand that people are cost conscious, that people are afraid of scars or want to minimize scarring, want to minimize downtime, it doesn't really make sense to say you want one part of the aging face and neck complex addressed and not the other. So a lot of these people, we have to explain that they're not a candidate. So what is an isolated neck lift? The nomenclature on this will vary depending on what surgeon you talk to, but for me, a neck lift would be an incision underneath the chin and contouring this area. We call this a submentoplasty sometimes, but if you have hanging muscle, hanging gland, extra fat that pushes things down, we can lift this area of the neck, the submentum, with a submentoplasty, or with the little incisions around the ear, we can tighten up the neck this way. And often those two things are combined. So you address the excess skin by removing it from around the ear and pulling it up. You address the excess weight or contour by doing the submental sculpting. That would be an isolated neck lift. What's a lower facelift? Again, this will vary depending on who you talk to, but it's the same thing. It's lifting the jawline and the neck, and the incision goes around the ear to do that. What's the difference between what I would call a full face and neck lift versus a lower facelift? Well, the incision, instead of stopping kind of right here, would come around a little bit more on the sideburn to about the level of the eyebrow right here, and allows you to lift here and here and here. So the reason why I say most people aren't a candidate, if you're in your 50s, 60s, 70s, and you're thinking, I just want a neck lift, if you have any sort of jowl forming, any sort of descent of your mid-face or your fat here with deepened nasolabial folds, and we just do this, what that really sets you up to look like is kind of like a hound dog. You're gonna have still drooping cheeks that are low and a tight neck, and that's not gonna match, and it's not gonna look right. And so we try to explain that as gently as we can, that the SMAS in your face is continuous with your platysma. This structure here, your platysma, comes up, becomes your SMAS. We lift the platysma in a neck lift and the SMAS in a facelift, and we keep that unit, that one singular unit, intact as one unit. I don't separate and just do the neck lift and leave it hanging up here because it's anatomically the same thing. It's like doing half the surgery. So when you ask for, I just want a neck lift, even though I have aging changes in my face, you're asking basically for half of a surgery, and I can guarantee 100% you won't be happy. You'll be calling the office wanting a revision, thinking that we didn't do the right thing, because really what you needed and what looks normal, what looks natural, which doesn't make you look strange, is to actually lift the whole unit, the SMAS, the platysma, into a face and neck lift. So that is what we do for face and neck lift surgery. If you're in your 20s, 30s, early 40s, you can get away with a little bit of submental kind of neck lift and a little neck lift back here to tighten the jawline. But as soon as you have changes in your cheek, in your jowl, kind of along your jawline, you really are talking about a face and neck lift. And that doesn't mean that we're gonna make your brows go up, that we're gonna do your eyelids and all that. I don't count that in the quote for a face and neck lift. We're just talking about lifting the cheeks up with the jawline, with the neck, so everything looks normal. I hope that clears things up. If you have questions about face and neck lift surgery, about profound, about aging face options, give our office a call, and everyone have a great weekend.